The human immunodeficiency virus, or HIV, attacks the body's immune system.
Right now, when I say HIV or AIDS, what's the first thing that pops into your mind?
Many people have the same idea of HIV. So, Gabriella, what do you think of?
Well, my overall idea of HIV was a sexual infection leading to AIDS and potentially death. I'm aware that there are different forms of HIV, so I guess we shall see and learn.
What kind do you know about?
Well, I am aware that HIV and HIV-2 are the main kind of types of HIV out there. HIV is the most widespread type in the population, where HIV-2 is mostly found in the western area of Africa and less prevalent in disease-causing type.
Is there any issue if you were to be diagnosed later on in the onset of your HIV?
Well, it is definitely recommended to be treated as soon as possible, and the earlier the stage of it is better for you. Antiretroviral therapy does work. Early diagnosis is important for the person suffering with it, as well as preventing it and giving it to other individuals.
So what kind of treatments would you follow or testing if you are potentially someone with this disease?
Well, first off, it should be tested with any doctor. It would be any doctor, midwife, nurse, or trained healthcare worker to obtain consent for and conduct the HIV testing. The most popular treatment that is recommended is what is known as gum. Gum represents genitourinary medicine from clinics and antenatal services.
What does tests involve?
Testing involves a venipuncture, which is a clotted sample, and a screening assay done in a laboratory. The testing costs about $5, but it varies on the kind of lab. A mouth swab sample is available and is mainly used in community outreach settings.
How long does it take and when should it be done?
Antibody production may take up to 12 weeks. Individuals should be tested right away if they feel suspicious of having HIV. If they get tested right away, they should still get tested 12 weeks after they were interacted with someone with HIV. Thank you, Angelo.
A person with chronic HIV infection may have just progressed with mild to absent symptoms in the first few years, and oftentimes will be unaware of the infection if left untreated.
In 2001, 2 weeks before my 18th birthday, I was diagnosed with breast cancer, and I had intense chemotherapy. And so, chemotherapy pretty much just destroys your immune system anyway. And so even though I was getting regular testing, I had no immune system to really test positive for the HIV antibodies. So in 2005, I had gotten really, really ill with pneumonia, and I was put into the hospital at Crawford Long University there in Atlanta. And after a few weeks, I got really lucky to have one of the most wonderful doctors in the field, Dr. Kimberly Warkowski, come on to my case. And she's actually the one responsible for doing the testing that led to me finding out that I was HIV positive.
The confusion about that stems from the fact that the precise mechanisms whereby the virus ultimately destroys the body's immune system are not totally and completely understood. It's very clear that the virus is the primary agent involved in setting off a series of events that ultimately lead to the destruction of the immune system.
What can you tell me about the HIV/AIDS that many people wouldn't know?
Severe HIV-infected adults will have physical and psychological issues with the AIDS symptoms that lead patients to delay, reduce, or terminate their treatment, which in turn can later on after the disease much worse. It's reported that a number of HIV symptoms experienced positively correlated with both depression and change toward to an unhealthy lifestyle with their own self-care.
Do you have any statistics on general HIV positive symptoms that these adults are facing?
Yes, I do. I'm going to provide a slide with all the stats on it. They also, too, deal with a lot of severe psychological issues, such as fears and anxiety.
It must be a lot to deal with and have a lot of emotional baggage to carry with a disease. The issue decades ago claimed that HIV was a gay disease. What do you know about that?
According to the Centers for Disease Control and Prevention, Black people made up to 45% of all HIV diagnoses in 2015. Though they were only 12% of the population, it's current that transmission rate persists. Half of the gay and bisexual African American men will become infected with the virus during their lifetime.
I know that there is an article from New York Times about the antiretroviral medication. How is that going?
The faces of one of America's most troubling public health crises, thanks to the success of the life-saving antiretroviral medication of 20 years now, they have done a lot of research and education that most of the HIV-positive people today can lead to a long, healthy